Bronchiolitis is an lower respiratory tract infection. Look at this picture, shows that normal bronchus and bronchiolitis bronchus. Look at this. Then chest X-ray findings. Look here. A detail going on. Introduction. Bronchiolitis is a common lower respiratory tract infection that primarily affects infants and young children. It is usually caused by viral infections and leads to inflammation and congestion in the small airways, bronchioles of the lungs. This condition is highly contagious and tends to occur more frequently during the winter months, while most cases are mild. Some may require hospitalization, especially in infants with underlying health conditions. Definition. Bronchiolitis is defined as an acute viral infection of the lower respiratory tract characterized by inflammation, swelling, and mucus accumulation in the bronchioles, leading to air obstruction and difficulty in breathing. Etymology. The term bronchiolitis originates from the Greek bronchos, meaning windpipe or airway, and the Latin suffix itis indicating inflammation. It refers to the inflammation of the small airways, bronchioles in the lungs, commonly caused by viral infections. Types. 1. Viral bronchiolitis. Most common type caused by virus like respiratory syncytial virus RSL. 2. Bacterial bronchiolitis, less common, may occur as a secondary bacterial infection. 3. Obliterative bacteriolitis, a chronic form that results from severe lung injury or inflammation, leading to fibrosis and obstruction of the bronchioles. Causes: 1. Respiratory syncytial virus RSV, most common cause. 2. Influenza virus. 3. Adenovirus. 4. Para-influenza virus. 5. Human metapneumovirus. 6. Coronavirus. 7. Mycoplasma pneumonia, rare bacterial cause. Risk factors: 1. Age, less than 2 years, infants, especially less than 6 months. 2. Premature birth. 3. Exposure to cigarette smoke. 4. Lack of breastfeeding. 5. Crowded living conditions. 6. Daycare attendance. 7. Underlying heart or lung disease. 8. Immunodeficiency. Complications: 1. Respiratory failure. 2. Dehydration. 3. Secondary bacterial infections. Example: pneumonia, otitis media. 4. Prolonged wheezing or asthma-like symptoms. 5. Hospitalization in severe cases. Pathophysiology. Pathophysiology of bronchiolitis, step-by-step process. 1. Viral infection initiation. 2. Viral replication and immune response. 3. Mucus production and bronchiolar obstruction. 4. Airway narrowing and resistance increase. 5. Impaired gas exchange and hypoxia due to airway obstruction. Ventilation is mismatched with perfusion, leading to hypoxia. Low oxygen levels in blood. Some areas of the lung receive blood but no proper ventilation, causing hypoxia. 6. Increased work of breathing. Infants struggle to breathe, leading to nasal flaring, retractions and trachypnea. Rapid breathing. Fatigue and respiratory failure can occur in severe cases if gas exchange is significantly compromised. 7. Resolution or progression. In mild cases, the immune system clears the infection within 7 to 14 days and inflammation gradually subsides. In severe cases, worsening respiratory distress may require hospitalization, oxygen therapy, or even mechanical ventilation. The step-by-step process explains why bronchiolitis leads to symptoms like wheezing, cough, and respiratory distress in infants and young children. Signs and symptoms: 1. Cough. 2. Wheezing. 3. Tachypnea, rapid breathing. 4. Nasal congestion and discharge. 5. Fever, low grade to moderate. 6. Retractions, visible sinking of skin around the ribs during breathing. 7. Cyanosis, brushing, discoloration of lips and skin in severe cases. 8. Poor feeding and lethargy in infants. Diagnosis: 1. History and clinical examination based on symptoms and risk factors. 2. Chest X-ray may shows hyperinflammation and PET-C inflammation. 3. Pulse oximeter to assess oxygen saturation levels. 4. Nasopharyngeal swab for vital testing, example RSV testing. 5. Blood tests to rule out bacterial infections in severe cases. Nursing diagnosis: 1. Ineffective airway clearance related to mucus accumulation. 2. Impaired gas exchange related to airway obstruction. 3. Risk for dehydration related to poor feeding and fever. 4. Parental anxiety related to child's illness. 5. Risk for infection transmission related to viral contagion. Medical management: 1. Supportive care, hydration, oxygen therapy if needed. 2. Bronchodilators, limited effectiveness, used selectively. 3. Antiviral medications, rarely used except in severe cases of influenza. 4. Antibiotics, only if secondary bacterial infection is suspected. 5. Corticosteroids, not routinely recommended. Nursing management: 1. Monitor respiratory status, rate, effort, oxygen saturation. 2. Encourage fluid intake to prevent dehydration. 3. Saturation nasal secretion to improve airway clearance. 4. Administer oxygen therapy as prescribed. 5. Educate caregivers on symptom management and infection control. 6. Provide emotional support to parents and caregivers. Treatment options: 1. Oxygen therapy for hypoxia. 2. Hydration, oral or IV fluid to prevent dehydration. 3. Suctioning to remove excess nasal secretions. 4. High flow nasal canal therapy for moderate to severe cases. 5. Mechanical ventilation in severe cases with respiratory failure. Psychosocial medicine. 1. Parental education, explaining the disease causes and home care. 2. Emotional support, reassuring and counseling parents about the illness. 3. Community support programs, connecting families with resources. 4. Reducing anxiety, providing a calm environment for both child and parents. 5. Support groups, encouraging peer support for patients dealing with similar challenges. Prevention: A. Hand hygiene, frequent hand wash to prevent viral spread. B. Breastfeeding, boost immune protection. C. Avoiding smoke exposure, reduces airway irritation. D. RSV prophylaxis for high risk infants. E. Limited exposure to infected individuals. In conclusion, bronchiolitis is a common yet potentially serious respiratory infection in infants and young children. Early recognition, supportive care, and preventive measures play a crucial role in reducing complications and hospitalization. By educating caregivers and providing appropriate medical and nursing interventions, the burden of bronchiolitis can be significantly reduced, ensuring better respiratory health for affected children. Thank you. Have a nice day.